Hi, this is DrTiv and welcome to one of my videos. Today, we're going to be looking at easy camera settings. Now my last video, which you can see up there, was about how to take dental photography using manual settings. It went to the in-depths of the different types of settings you need to change to get good photos. Now that's great if you're trying to troubleshoot. But for most of us, we just want to pick up a camera and be able to take a picture really quickly to communicate to the patient. That's really simple with these cameras, and it's called Aperture Priority. With Aperture Priority, what happens is the only thing you set is how small or wide the aperture is, which is how much light is let into the camera. And the camera will decide on how fast the shutter is, how sensitive the film should be, and how much flash to use to get that image. Now, it's not going to be great if you want to compare side-by-side color or lighting, because that's going to change each time you push the button. But it's going to be enough to give you information to give patients understanding of their conditions so that you can communicate to them and have them accept treatment. Now, it's really easy to do that. No matter which camera you have, they're going to have an Aperture Priority symbol. For my camera, which is a Nikon, it's an A. Click it to A, and you're going to have a wheel somewhere in the camera, which you're going to be able to set that Aperture Priority to. Now, as you roll it, it'll go all the way down and all the way up. Now, for an SLR camera, if you remember from my last video, you want to set it to 22. So you set it to 22, and then you're good to go. Now, the question I get asked is, how do you zoom up on these cameras? Well, the answer is most of these have a fixed lens, which means they have a fixed focal length, so you can't actually zoom on them with the camera. The only way to zoom is to physically go forward or physically come back in order to get closer or further away from the subject. So with teeth, the thing that I do is I look through the iris or the viewfinder. I move forward and close until I see a fuzzy kind of outline of whatever I want to take an image of. I half push the button which focuses, and then I push it all the way to take the photo. Easy as that. So there you go, simple dental photography. Set it to Aperture Priority with the Nikon or Canon, turn it to 22, and then move backwards and forwards until the image is in the frame that you want it, half push, and you're good to go. Now, if it doesn't take a perfect image, it means that there's something that's happening that's confusing the camera. Either gingiva's too dark, there's too much teeth, maybe the patient's whitening their teeth too much, and you might have to go to manual settings. Now, if you want to learn more about manual settings, like I said, look at my video that I've posted previously. I hope you enjoy these videos. If you do, make sure you hit the subscribe button. It's completely free to subscribe, and basically what it does is it lets me know that you like these videos so I can make more of them. Now, once you hit the subscribe button, you'll probably see a little bell icon. If you hit that, you'll get an email every time I post a video, so you're going to be one of the first people to see these videos. So I hope you enjoy this video. This is DrTiv, over and out.